Suggestions for public health care. Strengthening public health care and public care is an inevitable path. Kim Chang, professor at Seoul National University Graduate School of Health, director of Citizens Health Research Institute, it feels like the strengthening public health has entered a new era. The most important reason is that the health and medical environment is fundamentally changing. Korea has now entered a reduced society, in which births are decreasing at an incredibly rapid pace, and populations are decreasing in some areas. The least populous county has a total population of less than 20,000 people, and in many rural areas, the proportion of the elderly population exceeds 30%. There are also several places where the population continues to shrink and is expected to destruct soon. These population and local conditions directly affect the medical market and the medical economy. Korean medical care follows market principles because most medical institutions are established and operated by the private sector. It depends on the number of institutions or the number of beds, but as a result, the proportion of public healthcare is less than 5 to 10% of the total. Korean medical care should be called almost entirely a market-type medical system, and everyone is an economic entity that must survive in the market except for health centers, and health clinics. Why are there so many hospitals that are not worthy of their name? Even if there are no hospitals in a small population area, even if there is a hospital, it is difficult to find a specialist. This phenomenon is not a coincidence, so try linking population reduction with market principles. This is exactly why there are no movie theaters, franchise coffee shops, bookstores, and large marts. If demand is low, sales fall, and management balance cannot be met, the market will not be established. If the population decreases further, this medical market will shrink further. It is said that hospitals cannot exist in some areas, but the number of clinics may decrease in the future. This is because small clinics also need to treat patients on a certain scale to make ends meet. They say that they will visit more medical institutions because there are many elderly patients, but if the total population decreases, medical use will eventually decrease. Another problem is rapid aging. There will be no further explanation for the trend. The problem is that as the elderly population increased, the past medical model, that is, the healthcare system centered on hospitals and acute treatment, faced a fundamental contradiction. The care crisis is important, but only one sign: the supply and demand of medical personnel, the management of medical institutions, the financial income and expenditure of health insurance, and the profitability of related industries all change, and the past medical system, that responded to the capitalist market system, is difficult to avoid a crisis. The way to respond to this crisis is largely divided into two branches. The first is to continue to leave it to market principles, but it is not actually an alternative because it means to do as we have been doing. The basic principles of medical care, and services to the elderly remain the same. Residents have to visit medical institutions in nearby metropolitan cities, just like visiting movie theaters or computer stores, and as a result, hospitals, clinics, and doctors flock to cities where the market runs. Since public guarantees cannot maintain the medical and care system, dependence on individual and private insurance will increase, and care and services for the elderly will face extreme inequality. Now, the central and many local governments seem to follow this market principle without knowing it. Although it is not disclosed, there are many attitudes that seem to give up the most basic health care base. If hospitals, nursing homes, factories, and universities follow economic logic, it is natural to think that white medicine is invalid for population decline and economic contraction. It is said that companies and schools should have a living base, and it is a vicious cycle in which the population is small and economic capacity is not within reach. As far as the region's competitiveness is concerned, the dilemma is that areas with declining populations in the non-metropolitan area are unlikely to win national market competition. I think only a second alternative, namely a significant increase in public institutions and public services, is possible. At every election, pledges are rampant rather than establishing new medical schools in every corner of the country, but they are all impossible dreams in an extension of market principles. It is said to establish a community service system, but it is impossible to cover finances as long as it is included in the private profit model. As long as the market system persists, all actors can survive and win in the market, but the market principle does not work unless the market exists as a market. How big a market will be created in a county area with a population of 20,000 or 30,000? The regional growth model of the time of developing countries should be forgotten. Some people say to utilize the private sector, or refer to the public-private cooperation model, but this is also possible only when there is a market to some extent. How much can we endure by providing money and manpower to private providers in operation? Talking about market principles over a market that does not work is nothing more than a self-contradiction. If substantial financial support is required publicly, it is more efficient for the public sector to operate and take responsibility directly. It is easier to increase the number of public institutions. So I am not arguing for strengthening public services. Specific measures such as attracting local medical centers run by the province will be omitted, saying that it is okay to take over private hospitals with poor operations. However, it emphasizes that the state is the first to take responsibility in any form and method, and that it is most important for the central government and local governments to take responsibility together. The idea of narrowing public health care to hospitals and hospital-centered services should also be fundamentally changed. More actively, the hospital model itself should be reformed. It is urgent to convert models such as hospitalization, acute treatment, technology-centeredness, and facilities to chronic diseases and persistence, region and care, and dormant services. It is now necessary to strengthen public health care and care beyond expansion of public hospitals. Again, there is no choice but to leave the current state as it is, or to take the public's initiative. It is regrettable that the electron's path seems more likely to solidify as it is. If it costs a lot of money to expand public health care, and this should be supported by political will at the national level, the state reason for the new system is passive, and the political power of the party and region of pain is disadvantageous in all respects. In order to reverse this relationship, a wide and deep movement as to strengthen public health care must be re-established.